It's the end of an era for the UH Med School. 1 week from today, on March 1st, the Dean of the John A. Burns School of Medicine will retire. Dr. Jerris Hedges has been the Dean of JABSOM for the past 15 years. And here with us now is the Dean, Dr. Hedges. Thank you so much and congratulations.
Oh, thank you. I feel good about this transition because I've got a great team that will lead the school on to even better things. But it's amazing that I'm able to now pause and look back at all the things that we've been a part of over the last 15 years.
And speaking of which, what would you say is your biggest accomplishment? What do you want people to remember about what you did over the past 15 years?
Well, we tackle a lot of issues, and it's hard for me to pick one. I do want to point out our students are superb. Our medical students are recognized around the nation for being excellent learners and thoroughly prepared for practicing medicine. And they're not only great clinicians, but they understand the culture of the patients that they take care of. And so we just have a phenomenal educational program, and it's been recognized significantly. When I came here, unfortunately, we were only seen as like 102 out of 110 schools on the national ranking, and now we're up in the top 25 consistently. And that's really just a recognition of the quality of our students, quality of our faculty. And now, of course, we're focusing on how do we grow the workforce? How do we get more practitioners to the neighbor islands where we need them the most?
You know, speaking of the students, the med school students, a lot of them have Hawaii ties, right? And a lot of them come back to Hawaii to work.
Absolutely. About 85% of our student class each year is selected from Hawaii. And we do that purposely, not only to give opportunity for students from Hawaii, but also to give our students the best connectivity with this school so that they will consider Hawaii as their future practice site. So this is important for us to grow the doctors. We have to both grow them and retain them.
And the doctors, for example, here in Hawaii, they tend to go to the mainland, right? And how do you get them to come back?
Yeah, well, about 2/3 of our students will need to do training on the continent because we don't have enough training programs based here in Hawaii and enough slots in the programs that we do have. JABSOM is probably the largest sponsor of training programs after medical school, but we still don't have enough for meeting the needs of our population here. So we're working hard to create more training spots here in Hawaii, which will be one factor. Also, those who leave to do their training elsewhere, we work with them to help reduce their educational debt while they're in medical school, so coming back will be much easier. And also, we're working with our local institutions and our legislature around loan repayment programs to reduce the educational debt. So it's because of the cost of higher cost of living, and it's really important for us to get the barriers for coming to Hawaii down. If we can do the training here after medical school, we're keeping close to 85% of folks here to practice, and that's the highest rate in the nation.
That's great to hear. And finally, what's in store for your future? Are you staying in Hawaii?
Absolutely. Hawaii is my home. There's a lot of things that we still need to do are in the healthcare area here in Hawaii, and I hope to be a big part of that. But I'm really excited about National Institute of Health grant looking at disparities in health outcomes amongst the populations here in Hawaii. And it's an opportunity to train the next generation of investigators who will be helping improve the health of people in Hawaii. So that's a great project, and I want to continue doing it. I've got a great partner, Noreen Mokoau, who's the former dean of the School of Social Work, and she's been just a terrific supporter.
Great. Thank you so much, and congratulations,
Well, thank
Dr. Jerris
you.
Hedges. All right, Mika, over to you.